Good morning, everybody, and thank you for coming here today. My name is Sean Thaxter. I'm the Chief Executive Officer of Indivior, and I'd like to say what a tremendous privilege it is to be able to come and participate in the conversation today about the way forwards. Indivior is a global pharmaceutical company committed to changing patients' lives by developing medicines to treat addiction and its co-occurring disorders. We are encouraged that around the world, the opioid use disorder is increasingly being recognized as a treatable disease and not a moral failing. Significant progress has been made over the past 2 decades in understanding the patient journey towards recovery, increasing scientific understanding of addiction as a disease and advancing innovation in evidence-based treatment. New public policies have helped build the national, state, and local infrastructure critical to helping patients and caregivers access resources, funding, and evidence-based programmatic support in communities across America. And in January 2020, the Substance Abuse and Mental Health Services Administration released the 2018 National Survey on Drug Use and Health for Key Substance Use and Mental Health Indicators in the United States. The 2018 data reported decreases in both the percentage of people who reported opioid misuse in the past year and, for the first time in over a decade, a decline in drug overdose deaths. However, the truth is that the journey of recovery for millions of patients is not over. But the tragedy is that for the vast majority, it's not even begun. The patient need continues to be urgent, as evidenced by new data from recently released reports from the White House Office of National Drug Control Policy, the National Drug Control Strategy, and the accompanying National Treatment Plan for Substance Use Disorder. The data highlight that 21.2 million Americans need treatment for substance misuse disorder. However, only 3.7 million receive any kind of treatment. This means that 4 out of every 5 people suffering from addiction, our family, our friends, our neighbors, remain underdiagnosed, undertreated, and undersupported, leaving them feeling isolated, marginalized, lonely, and in despair. The National Treatment Plan for Substance Use Disorder frames multiple factors which contribute to this treatment gap between those needing treatment and those receiving it. People in urgent need of treatment are often unaware of their treatment options. They have limited access to treatment with counseling, or they simply do not seek it out because they're afraid of being stigmatized. Societally, we still have more work to do to eliminate the ignorance, the apathy, and the prejudice that creates stigma that is a reality for so many people struggling with this disease. We must deepen the understanding of opioid use disorder as a chronic brain disease and continue to build awareness that this disease can and must be treated, much like other chronic diseases like diabetes and heart disease. One of the most significant contributions to furthering our understanding of the science of addiction was led by the research of our keynote speaker today, Dr. Nora Volkov of the National Institute on Drug Abuse. Due to NIDA's groundbreaking research, we can now see how addiction affects both brain structure and function, trapping people in a cycle of opioid use, withdrawals, and cravings, all of which reduce their ability to control their own substance misuse. This research has been critical in defining addiction as a disease, advancing our understanding of how the disease affects the brain and furthering the development of evidence-based treatment that can help patients move towards long-term recovery. Patient voices are vital in helping raise awareness as a disease. By speaking out, patients help to destigmatize the disease of addiction and other mental health illness and provide hope and help to others. Of course, we're all individuals and every patient journey is different, and we're fortunate to have the opportunity to hear a personal experience from one of our panelists today. Advances in federal and state public policy are also acting as a catalyst, creating a fundamental mindset shift that continues to move addiction towards mainstream medical practice, while putting resources in place to help more people, caregivers, and their communities access the supports they need to move towards long-term recovery. For example, new laws like the Comprehensive Addiction and Recovery Act and the Support for Patients and Communities Act have provided billions in funding for new prevention treatment programs and treatment support. These significant federal investments are making a difference as more of these resources move to the front lines. We are seeing evidence of this in the number of healthcare providers who have become waived to treat. They increased by a record amount in 2019. This funding also recognises the value of prevention programs and further investment in expanded research into opioids and recovery. We are joined today by two members of Congress, Representative Paul Tonko from New York and Representative David Joyce from Ohio, who are both tireless champions for the recovery community and patients. Both members have been strong advocates, introducing legislation, co-chairing the Congressional Addiction Treatment and Recovery Caucus, and advocating for funding to help combat the opioid crisis. We appreciate their tireless work advocating for laws and regulation that impact the availability and access to effective treatment, including counselling, for patients, which plays a critical role in helping to reduce the number of people suffering from addiction. As stakeholders, we must all work together to destigmatise those seeking treatment, to educate about available treatment options, and to reduce barriers to access medications to treat opioid use disorder, including counselling, to help move people on the path to long-term recovery. We know too much about this disease for so many people to struggle continuously. So thank you very much for this opportunity to engage with you today and to learn from this distinguished panel whose dedication and leadership continues to make a meaningful difference in changing outcomes for patients. Thank you.